We all remember how awkward and weird growing up was. However, there is a positive to this. According to a 2014 study done in Chile studying clinically obese children and children who were not obese, kids who were not considered obese had more social interactions during the school day, positively developing them socially. This resulted in these children performing better when it came to things like group problem solving and communication. These social interactions came from activity as simple as kids playing tag or hide and seek, or more complex activities like playing soccer or having a dance recital, many of which clinically obese children could not do.
According to a peer-reviewed 2015 article done in the University of South Carolina Medical School, children who participated in physical activities had higher bone masses than those who did not participate in physical activities. Physical activity puts mechanical stress on the bones, which in turn stimulates osteoblasts and osteoclasts, which rebuild and remodel our bones. According to the article, that children with healthy total bone masses have a lower chance of receiving a fracture than those who have a lower bone mass. According to Healthy Kids, a website run by the Australia's Ministry of Health, physical activity promotes good sleep. From the website, it says that at least 30 minutes of physical activity during the day has shown to effectively decrease a child's energy levels and allow them to sleep earlier and have earlier bedtimes. The website also states that technology is becoming a problem with children nowadays. Kids are staying up late or past their bedtimes, watching TV, or on electronic devices like video games and tablets, which is affecting their quality of sleep.
Number 3. Don't be afraid to ask for help. It'll benefit your kids and you. In 2019, a pilot program was launched by the University of Guelph in Canada to help prevent childhood obesity at the home level and to study the effects that changes in family lifestyle behaviors can have on the body compositions of the parents. Spanning 44 families with children between 1.5 and 5 years old, the study randomized the families into 3 separate groups. The control group only received emails with general health information. Another group had 2 home visits with a health educator, along with emails and weight loss incentives, and the third had 4 home visits, along with emails and meal incentives. The results were impressive. Parents in groups that received extra advice and guidance from a health educator for 2 to 4 visits lost over an inch in waist circumference and were nearly 7 pounds lighter on average after 6 months. Sometimes a little more support is all you need. Number 4. Weight loss in obese children can drastically improve long-term heart health, and it's never too late to start. Common carotid artery intima media thickness, or IMT, is a measurement of the 2 innermost layers of the carotid artery's walls, which serves as an indicator for increased risk of future cardiovascular health issues. The thicker it is, the higher the risk. In a wide-ranging study of over 2,000 Finnish children as they grew to adulthood, it was found that the children who had high BMIs throughout the study had much thicker IMT measurements than the children who began with high BMIs but were within a normal range by adulthood. This shows that with dietary and lifestyle changes, the negative effects of childhood obesity can be reversed.
Number 5. Physical activity prevents and improves airway function. Obesity and asthma have equally and dramatically increased over the past few decades. Studies have shown a clear and direct relationship confirming obesity as a causative agent to asthma. An international study on asthma found a strong association between television watching and asthma. A 10-year community-based study found physical activity reduced the risk for asthma. In addition, those with asthma had shown a reduction in symptoms, duration, severity, and number of attacks with regular exercise. Number 6. Physical activity improves memory and cognition. 2 independent studies looked at the association between obese children and white matter in the brain. The report of these studies illustrates a positively related link in brain health and cardiorespiratory and muscular fitness. White matter increased in 6 main areas of the brain with routine fitness. These areas are associated with storing and processing memories, language comprehension, processing sounds, and coordination. Examples of cardiorespiratory exercise include brisk walking, jogging, swimming, dancing, and biking. Some examples of muscular fitness activity include weight-bearing and plyometric exercises.
In recent years, childhood obesity has been on the rise, and so has increased blood pressure. Both of these are associated with cardiovascular disease. In fact, 70% of obese children have at least one cardiovascular disease risk factor, and 39% have two or more. Overweight and obesity is associated with a greater mass of adipose tissue, which includes adipocytes as well as pre-adipocytes, macrophages, and fibroblasts, among other cell types. These cells grow greater in number and size, which leads to an imbalance of adipose tissue dysfunction and a chronic inflammatory state. Metabolic factors contributing to obese-related hypertension are an increase of the sympathetic nervous system and an increased renin-angiotensin-aldosterone. The American Academy of Pediatrics recommends weight loss, dietary changes, physical activity, education, and counseling as the best treatment approach to obesity-related hypertension.